Good afternoon. Thank you for joining us for today's special edition of the NILE webinar. This is Brianne Van Dyne, Education Manager for Immunize Nevada, and I will be today's moderator. If you're joining us for the first time today, welcome. Our previous NILE webinar attendees will notice that today's presentation is a bit different than what we normally broadcast to the coalition. Immunize Nevada's tagline of saving lives by preventing disease and promoting health includes bolstering resources surrounding mental health as well, especially in the context of mitigating the effects of infectious disease. We've chosen to partner with our valued collaborator, the Spring Mountain Treatment Center, for today's webinar in response to the emergent need of our partners to address the mental health concerns of patients and clients in the wake of the COVID-19 pandemic. Our hope is that you'll walk away with a better understanding of the pandemic's effects on our community's youngest members, along with garnering some tools for how best to apply this to your respective workplaces and home environments. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected or if our connection is poor for any reason, please hang tight and we will continue as soon as we're able. Second, please locate the Q&A box at the bottom of your screen. If you have any questions at any time during the webinar, type them there and we will address those questions at the end of the presentation. Additionally, if you have requested continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended. All CE certificates will be emailed out within the next week. Please note this webinar is being recorded. The archived presentation and slides will be available on immunizenevada.org/NILE within 1 week. Before we begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization and infectious disease-related topics through a non-branded, unbiased presentation. I'd like to now turn it over to today's presenters, licensed clinical social workers Tiara Atkinson and Sabrina Hassim. Tiara holds a Bachelor of Arts in Marriage and Family Therapy and a Master of Social Work from the University of Illinois. She is a licensed clinical social worker who is the adolescent intensive outpatient therapist at Spring Mountain Treatment Center. She has worked in the mental health field for 19 years in various settings, including outpatient mental health offices and drug court treatment. Sabrina received her master's in social work from the University of Southern California. She is a case manager and alternative treatment clinician at Spring Mountain Treatment Center, working with children, adolescents, and adults. She has been practicing social work in various capacities from interpersonal violence to corrections. Welcome, Tiara and Sabrina.
Well, thank you so much for having us. This is Tiara. First, I do want to mention that anything that we share here on the presentation, you are welcome to pass along to your patients as needed. So feel free to use this as you see fit to improve your patient's mental health. We can move ahead to the objective slide, please. So here's the objectives for today. We're going to identify the impact of COVID-19 crisis on children, adolescents, families, and the community. We're also going to identify problematic behaviors in children and adolescents, which may be the result of the COVID-19 crisis, things that we're seeing kind of on the front lines here. We're going to recognize emotional issues and trauma triggers in children and adolescents, which may be brought on by the COVID-19 crisis, and identify several ways to address behavioral issues, emotional response and trauma issues in children and adolescents' response to COVID-19. We're going to understand when to seek professional help and identify various treatment options available.
All right, and then this is Sabrina. So I'm going to be talking about the impacts of COVID-19 on children. Specifically, when we're talking about children, we're talking about kids up to the age of 11. So as adults, each of us have had our own individual responses to COVID-19, whether it's been sleepless nights, irritability, family conflict, being withdrawn, financial instability and insecurity, differences in your appetite, like you can name it. We have different family dynamics that we are immersed in on a daily basis. Single parents, children with special needs, chronic health problems, abuse. These all existed prior to the pandemic that we're in now. And so now if you take the situation that we're in, remove the structure, the resources that we had before, our day-to-day and the regular life stressors are now exacerbated. There's a lack of outlets and resources for both children, teen, and adults. When we specifically talk about children and their development, they're in a stage where they're sponges. With brain development, they're true learners right now. They're absorbing their environment, mimicking their surroundings, developing rationalization skills, reasoning skills, learning to do things on their own. Children have energy and need things to do. They act out when attention needs aren't being met. They require constant attention and request attention from their preoccupied adults, their caregivers. Their caregivers who might be, working from home, dealing with other stressors that are happening in the family, applying for unemployment, being on the phone, communicating with family, checking in on family, all these different things that we're doing on a regular basis. And when children aren't receiving that attention, they might do things that would prompt attention from adults. So like acting out, yelling, screaming, crying, throwing tantrums, and other like maladaptive behaviors. So there's a huge impact on the lack of structure that they have in the home because they were getting that at school. So with school closures, you have a significant change in their day-to-day. Schools provided structure and a primary source of learning. And when we're talking about learning, we're not only talking about, math and science, we're talking about them being like molded into little human beings, how to interact with their peers socially appropriately, following directions, guidance, manners, like other things that we weren't maybe necessarily acknowledging before. And so now we're at home and we're trying to figure out how do we supplement all of these activities while we still have to do our day-to-day, provide for our families, make meals, different things like that. With children responding to traumatic events, it mimics trauma, PTSD, in a lot of different ways. Children are it's harder for them to self-soothe. There's changing in sleeping, eating habits and patterns, being withdrawn, clinging to parents or having, attachment style issues, regressing to earlier childhood behaviors like thumb sucking or wetting the bed, difficulty with concentrating, or even physical manifestations like, tummy aches or headaches, different things like that. So obviously all of these effects, when it's happening to a child, it also impacts the parent. Parents, we're like I was saying before, we're dealing with the day-to-day. And so now on top of that, now we have to occupy our children with activities, try to soothe them, try to, be the parent that they need at this time. So because children are at home, there's a higher demand from parents and caregivers, which can lead to, family violence, both witnessing it, being victims of it, or perpetrating it. Life was stressful before, and now things are a lot more complicated. There's actually been a nationwide trend of domestic violence calls increasing with law enforcement agencies. With our local community, the Las Vegas Sun reported a few weeks ago in April that they had a 13% uptick in domestic violence calls, which equates to about 500 additional 911 calls. So obviously there's an increase in domestic violence. So there's going to be, children who witness it, other people in the home who witness it, which brings us to also, child abuse. Risk factors to intimate partner violence or domestic violence include all of the impacts that we were talking about before, but specifically financial stress, isolation, a history of violence or perpetration, substance usage. I do want to highlight that the number, that 13%, is an increase in reported domestic violence cases. However, that is reported, whether it's self-report, a neighbor overhears you, somebody sees you in a parking lot. And so now that we have, children that are added into the mix, you have children, other people in the home who are exposed to that family violence. And in cases like that, where you're in maybe a violent household, leaving for home, leaving leaving home for school or to go to work was a means of respite and safety. If we talk about CPS and children experiencing violence, the primary referral source for Child Protective Services is school, where you have higher rates of disclosures to trusted adults like teachers, supportive staff. You have teachers who are able to observe and monitor changes in behaviors or, any physical signs of abuse. We can talk about, red flags for abuse that are noticed by teachers because they get to see them on a regular basis. Also, it's a chance for the child to be away from their abusers, their perpetrators. And so there's, a lot of anxiety with being around folks like that. So going to school was a way to seek safety. So that safety net is no longer an option for a lot of different people. With the Child Mind Institute, it's actually a really neat organization. If we can go to the next slide, I have a screenshot of their website. And Child Mind Institute has resources and tips for specific topics for children, as well as other life stages, like handling disappointment with children. So when I mean that, it's how do you communicate to children that they can't see their cousins, that their family vacation over the summer is canceled, that they can't go to the amusement park for their birthday. These are all, small, like almost microaggressions, where it's small disappointments that can, bleed into like a big tantrum or kind of like a child being in distress. So as adults, we find it difficult to navigate the uncertainty. So it's understandable that it's hard for a child to conceptualize what's really going on. There's also tips for more specialty family dynamics, like single parents, supporting children at home who have ADHD. So there's a lot of neat resources on that website to cater to your children or adolescents. And we can go to the next slide.
Okay, so myself, Tiara, I work with adolescents in an intensive outpatient group setting. We are currently running that on Zoom. Those ages are 12 to 17. And so what we're talking about today, while there's no research, we're actually going through like ground zero, what we're seeing with the patients that we are working with. And so as far as the adolescents go, these are things that they have reported to me that have changed in the last 6 or 8 weeks. They're unable to see their friends, teachers. Some of them, the teachers in their schools, are some of the only healthy adults that they interact with. Family members who do not live with them. A lot of them have, grandparents or aunts or uncles that are additional social supports for them that they no longer are able to interact with face to face. Additionally, they're unable to participate in pro-social activities they enjoy. One patient said, I just love shopping. I love going out and shopping, and she didn't have the opportunity to do that anymore. I've had patients who love to go to the skate park or ride their dirt bike at the park, Red Rock, or playing, any kind of sports like spring sports that they've, historically been a part of, whether it's soccer or baseball or whatever. And those things that help fill their time and give them activities and healthy social interactions with peers and coaches, those things are no longer a part of their day-to-day living. And so they've had those removed from them. Also, lots of reports of increased difficulty regarding school because of the online school platforms that have been offered. Some people don't have adequate access to those school platforms because of outdated devices or poor Wi-Fi. Additionally, like when they were sitting in a classroom with a teacher, they could ask a question and get a real-time answer. At this point, they're emailing the teacher and waiting for indefinite amounts of time. So they're having some difficulty making progress with their school requirements, and of course decrease as educational supports for kids who maybe would go to a resource room or have an aide or additional supports in that area. Emotional changes that they have, that my patients have indicated, they feel way more isolated. So I work with a lot of middle school and high schoolers, and the structure, as Sabrina was saying, is built in. Structure is great for our brain and it's great for our mood. And when you take away that structure, there's all these emotional changes that occur. And so for my patients, they're feeling more isolated, mainly because they're staying in their rooms more. They're not, getting out and interacting as much as they, used to at school and that sort of thing, feeling more depressed because they're staying, their rooms or their worlds have gotten very small, so that it only includes basically their living environment to some degree. And so that makes them feel more depressed and anxious. Some physical changes. I have had patients who say, I get up so little that when I need to get up, I notice my body hurts, or it's harder for me to keep going. Like I had one patient who said, I used to have to walk from one end of the high school to the other for classes, and that kept my stamina and my activity levels up. And now I just have to stay at home, and how that has impacted her ability to, feel like her body is working with her. Additionally, decreased routine and self-care, lots of sleep issues going on right now. Patients staying, we actually had a little competition, who could go to bed the earliest in my groups, because patients were saying, Miss, I didn't go to bed till 9 o'clock this morning and I only slept until noon, because they're watching, or they're playing video games, or they're on the phone or FaceTiming or whatever they're doing with their friends. And so that's really impacting a lot of their moods as well, because they're not monitoring their sleep patterns. They're not making sure, oh, it's time to eat, like my body's hungry. They're not taking care of, maybe showering, because they're not leaving the house. So I guess they, perhaps don't think it's as important now, those kinds of things. I did have one patient say, a good thing that's happened because of COVID is that they're reconnecting with their family and not avoiding them so much. So, whereas if they were spending time with friends and that sort of thing, their family got pushed to the back burner. But when you're in the same living environment with your family, it's a lot harder to avoid them when you don't have friends that you can actually go out and spend time with. So they're actually finding that they're able to reconnect with family and kind of open up some of the communication lines a little bit better. And they're starting to feel a little more connected in that way. So if we could go to the next slide, please. All right, some emotional impacts that we've seen: increased anger and frustration. Again, like we've kind of turned the whole volume up on stress and anxiety, right? So we brought the walls of our world have kind of closed in on us. And anytime we feel like we're under that kind of pressure, our anger and frustration levels increase. And so we're seeing a lot of that, harder, more negative, difficult emotions to manage. Again, increased depression, anxiety. If they're able to get out of the house to go to the grocery store or to an essential appointment, are they at risk for becoming sick? Those kinds of worries. Increased tension throughout the community. One of my patients said, Miss, everywhere I go, it just feels tense, and like they sense it. And so, as Sabrina was saying, like as adults, we have other tools that we have at our discretion to use to kind of manage that increased tension. But kids don't have all of those tools simply because they haven't developed them, or the tools that they have used in the past have kind of been taken away during this COVID pandemic. So the sense of increased tension is like very noticeable to them.
And with the uncertainty and the fear, a lot of people do certain behaviors out of that uncertainty and fear. Even something that I noticed maybe the first 2 weeks that everything was happening, I went to the grocery store and I saw 2 fights break out, which I'm pretty sure is not an uncommon thing that people have noticed. But I could only imagine if maybe there was a teenager or a child who was bearing witness to that, what kind of emotional response would they have? And what kind of questions would they have? So uncertainty and fear kind of go on hand in hand, and we're seeing it manifest in a lot of different ways, especially on the inpatient side.
Additionally, increased frustration with school. I have a lot of kids that because who I need to, so kind of this idea that, I've done what I can, but it's not really going to matter. And so the idea that, they just, I guess like maybe they give up as opposed to if they would be in the school building, they would have additional resources to help them keep going to complete their requirements. Of course, more distant relationships with peers, as we all know, with children and adolescents, especially I think the middle school and high school groups, their peer relationships are some of their top priorities. And those have been basically taken away at this point, except for through electronic avenues, whether it's, gaming online together or, chatting on, text messages or Snapchat or whatever. And then lots of grief and loss issues, events that are special, graduations, proms, maybe some, kids who have to repeat certain grade levels because they weren't able, maybe their third quarter grades were not high enough to help them pass, and there are no fourth quarter requirements. And so it's, prompting some repeating of grade levels or summer school requirements. Maybe even some loss of family members because of the virus, and certainly loss of freedoms, the inability to, go out and pass. Those are all like major emotional impacts for kiddos.
As far as trends with inpatient, obviously, if anybody's familiar with inpatient settings, the child or the person has some sort of threat to self or others, whether they're suicidal, homicidal, had a suicide attempt, had thoughts, self-harming behaviors, things of that nature. And so with all the things that Tiara was covering in that last slide, you can only imagine that they're exacerbated. So for example, if we talk about the peer relationships, teenagers love their peer relationships. It's more important than their primary family at some times. With them, they almost do whatever it is that they can to make sure that their peer relationships stay intact. So they're not isolating, they're actually running away from home for hours to days at a time, having no contact with their family. There is high-risk behaviors like substance abuse, just to, pass time or experiment, or, teenagers are impulsive. If it's there and they have another peer that maybe offers it to them, then they're going to do it. Something that we've also noticed on the inpatient side for maybe the last 2 months is the kiddos who come in who had the high risk impulsive behaviors. The frequency of their admits were already pretty rapid, like maybe having hospitalizations 1 to 3 times, like every few months. We're actually noticing them rapidly readmit a lot more. The majority of them are actually kids in the foster care system. That's what we're noticing a lot, either in DFS custody at Child Haven or in like a community setting in a foster care home. We're seeing a lot of that. But yeah, we're just seeing a lot of the running away, the risky behaviors, just a lot of different dynamics that we're seeing. Family violence coming from the children. So either, acting out or having aggressive behaviors towards the animals in the home, siblings, parents. The defiance towards parents is also a lot higher. If you can imagine being at home, or maybe you're dealing with it yourself, being at home with your children all day, you're gonna butt heads, things are gonna happen. So yeah, that's something that we've noticed on the inpatient side, is that the behaviors are a lot more extreme. With the emotional response to crisis, series of disappointments, not being able to go to school. A lot of kids wanted to go to school to socialize. Birthdays are still happening, different holidays are still happening. And so to be told, okay, we can't go to Taco Tuesday, we can't get pizza on Friday night, we can't go to the water park. And especially with the weather out here in Vegas, it's already too hot. So going outside as like a release or something to do that's cathartic is a lot more limited. So that's, unfortunate, but something that we're kind of having to roll with the punches on that one. Professional goals, with especially our teenagers who are juniors, seniors, they're trying to do things to put on their resume. They're trying to get their grades together. They want to, take the ACTs, SATs, or begrudgingly are taking the ACTs, SATs. They're coming across a lot of barriers. Even for adults, we're dealing with unemployment, the uncertainty of if jobs are going to be available in futures. Are certain areas or certain things, are they going to cease to exist? Do we need to find out different jobs that we need to pursue? Kind of similar to when the recession happened, where different areas or different professions kind of went under for a period of time. Now we've got kids or teenagers who are worrying about, what is that going to look like for me when I turn 18? Or, for example, I think like ROTC, different things like that. Like, we want to have these pro-social behaviors. We want to have these things that we can do to enhance like our life goals, our career goals, and that's just not happening right now.
Yeah, we've had patients who, they're trying to complete high school and learn some skills to set themselves up for success professionally, like through Job Corps specifically. And Job Corps did have to shut down. And so, a lot of those kids then have returned home in the home environment. Maybe the reason why they went off to Job Corps was because home environment was not safe. It wasn't a secure place for them. And so now they're returned back to those environments. And so we have seen, the ramifications of those kinds of programs that are not available at this time, and how that impacts the hospitalizations and professional goals and aspirations. As far as substance use, decreased supervision in the home, again, like what Sabrina was saying, because it's perhaps available, or there's, watchful eyes aren't on them. But at school, the setting is a little bit different. There's some more structure there, but at home, when it's unsupervised and unstructured, kids need healthy activities to participate in. And without some guidance from the adults in their life, they might tend to seek the maladaptive kinds of behaviors. So we're seeing increase in substance use because of there's lack of structure and increased amount of free time. As far as barriers to services go, with telepsych, while it's a great option, it's certainly better than having all options removed from a mental health standpoint. Telepsych has its own issues. For example, so I run groups on a telepsych platform right now, and there might be internet connectivity issues, device issues, there might be login issues. Privacy is a big one, making sure that I inform parents that your child will need a private place where they can share freely, but also the information of other group members is not overheard by family members walking past or sitting in the same room, that kind of thing. Additionally, things like discontinuation of in-home services. Here in Nevada, there's a lot of BST and PSR services, a lot of ABA type services. A lot of those happen in the home, even in-home therapy. Those have all had to be discontinued at this time for an indefinite amount of time. And those are all great sources of support for patients and kids specifically. And then as far as the trauma triggers go, what's it going to look like when life returns back to normal? So for trauma, it's definitely something that's treatable. Sometimes what happens in times like this is those trauma symptoms return. And so when life goes back to normal, there still may be more work to be done to deal with the trauma that's being experienced during COVID-19 pandemic and all of that. So.
All right, and then the next slide. All right, so continue on the impacts on mental health. So we've talked a lot about the importance of social interaction for our youth, and having those limited social interactions leads to more depressive moods, the risky behaviors that I was talking about before, on top of the stressors that they're going through already. Specifically, going back to school a little bit, a lot of the teenagers that have come across like the inpatient side are trying to make terms with, or are trying to go into the process of accepting that they may have to repeat the grade again. And that in itself is a huge stressor. Just having to repeat schoolwork or being held back, the social implications of being held back, the career goals, the things that you're aspiring to do, what that means for you if you have to repeat a whole grade again. So once again, the increased suicidal ideation, self-harming, different things like that. Being confined to a space with your family, not really having those outlets, it ultimately boils down to really maladaptive behaviors like that suicidal ideation. When we look at the family system, so the family in itself is affected. So if we talk about examples like layoffs, unemployment, the uncertainty, not having stable income, having to maybe find food banks throughout the day to make ends meet, having to move, downsize, change up your regular structure, cut the cable bill, different things like that, that can be a huge stress for the family. If we talk about kids and teenagers, a lot of the time adults like to think that they are sheltered from these problems, but they pick up on all these different things that are happening. And if parents, guardians, the family doesn't provide those answers to them, they find their own answers. And especially if they have, access to the internet, social media, different things like that, they get their information one way or another. And so that's where you have that uncertainty, that fear, that stress, and just exacerbating mental health symptoms, or like starting the onset of mental health symptoms. On a community level, the impacts that we're seeing, as far as long-term treatment, we're seeing a lack of availability in bed space. So for the kids, the teenagers that have had like persistent, prevalent behavioral issues, trying to get them into long-term treatment has its own barriers, a little bit more of a barrier to it now, to try to get them into an appropriate level of care. Outpatient care, which we were talking about, that's telepsych platform. Some of the feedback that I've gotten from a lot of teenagers who were engaging in outpatient care prior to admitting to the hospital is that it wasn't the same. Speaking to their therapist one-on-one was far more effective than having to FaceTime them while they're in the home where they want to complain about their family but feel like they can't complain about their family, or if they have, relationship drama going on or something that you don't want your parents to find out about, which, for teenagers, I don't think they want their parents to really know anything about them. So that is a huge barrier. And I believe that there's been like a big amount of no-shows for telepsych appointments just because of how folks find it, or at least the kids or the people who are receiving the care find it, ineffective, or almost to be just like maybe a waste of their time, or certain things that I've heard. From the inpatient side, when we've done family sessions, communicating with families, normally when you do family sessions, you're in a room with the caregiver and the child, and we're hashing things out, we're talking about things, we're disclosing things, we're safety planning for the future so that way we can avoid readmittance to the hospital. And now all of that is done via phone, and it's very difficult to have an argumentative child and an argumentative patient or a parent communicate effectively to one another, because I want to say like 7 times out of 10, the family structure didn't have healthy communication to begin with. And so when you're trying to have healthy communication over the phone, you have folks that are trying to speak over each other, or we don't know like whose turn it is to speak, and everybody's speaking at the same time, which has led to, the kids, the parents just being increasingly frustrated. It feels very ineffective as a service provider. And then, then you have, kids who are able to walk out of the room because their parents are just on the phone, instead of, in a room where you have like the fear of your parent looking at you. So it's a very different approach. And then, same thing with child welfare. When we were talking about child protective services, their approaches have changed drastically. Their referral sources are changing. The diminished social supports, mentorship programs, treatment facilities closing down because they've had their own outbreaks of coronavirus, and then childcare, which is like a huge issue everywhere, because now you have all these children who are at home. Not all parents are, not working. And so what do we do with that, especially when you have childcare facilities that were shut down for a period of time?
For sure. All right, so let's move on to the next slide. So there are some specialty populations that we work with that have some unique impacts from the COVID-19 pandemic. Specifically, I've worked with people with disabilities as well as substance use disorders. So we're going to turn this slide just a bit. I'm going to talk about people with disabilities and people with substance use disorders, and then Sabrina is going to talk about communities of color and the LGBTQ special things to consider. As far as people with disabilities, so I have lots of friends who are deaf and hard of hearing who use American Sign Language to communicate. And in school systems, when a deaf or hard of hearing kid who uses sign language goes to school, they have a live interpreter and they have access to language. Most 90% of deaf and hard of hearing children have hearing parents. Not all of them have great signing skills. So imagine a kid who goes to school who has access to an interpreter and perhaps other peers who sign at the same level of them. Now those kiddos are going home and maybe their parent doesn't understand them to the same degree that an interpreter or another peer who uses American Sign Language at their level does. So some limited, certainly far more limited accessibility issues with kiddos who are deaf or hard of hearing. I also have worked with people who are blind before, and so definitely have, all of the school things like resources that might put online are in text. And if they are, for whatever reason, perhaps in a PDF, some electronic devices that folks who have low vision use may not have the capability of reading certain types of documents. And so while text and Word and things like that work, perhaps PDF or something similar won't, or if it's like a GIF or a JPEG kind of graphic, someone who has low vision may not be able to see those things. So those are some specialty. Let's go back one slide, please. So those are some special considerations for folks who have certain disabilities. And as far as substance use disorders, a large component of being in recovery from substance use is having a healthy social system. The number one determining factor if someone can remain clean and sober is their social environment. And so whenever that piece is taken out of the possibility of finding support, sometimes we see a resurgence in substance use. On one of the final slides in here, which we'll get to in just a minute, but I just wanted to point out for substance use disorders, there is a link at the end of the presentation that has some specific resources for people to find online for recovery support for substance use.
All right. So with communities of color, this is Sabrina, by the way, studies have shown that COVID has disproportionately affected communities of color to include, access to resources, healthcare, different things of that nature. The CDC also released a report where they studied cases in New York and found that Black and Latino community members had a higher mortality rate. So when we talk about mental health, comparatively, communities of color have decreased utilization of traditional mental health resources like medication management and talk therapy. The form of mental health care can look more like community-based services, mentorship, physical education programs, church groups, after-school clubs, or school-based mental health services for communities of color. With school-based mental health services, obviously it was a lot more accessible and bridged a lot of gaps and mitigated barriers to treatment, like folks who have lower incomes or have maybe Medicaid, different things like that. Health insurance coverage, low-income households, transportation, those were all barriers to accessing treatment. So when it was at the school, like a school social worker, a counselor, a therapist, it was very easy for them to access that resource. And now that resource is no longer available. When we look at the LGBTQ plus community, especially our youth, some considerations to take in mind is there could be a lack of understanding by parents and families that prompt LGBTQ plus communities to not want to be at home, to not be around them, to seek other sorts of kinship. So that lack of acceptance and understanding can trigger a lot of feelings for folks in that community. It can arouse feelings related to guilt, shame, low self-esteem, whereas they had an outlet for school extracurricular activities, community centers. They provided a space to form alternative kinships that promoted positive mental health and the support that they needed. So we have a population that was already an at-risk population, but with coronavirus and having to, you know, isolate, be around family, that just increased their risk. And then even with the community, you can also talk about medical issues or, you know, other layers of a person other than, you know, their identity or their sexual orientation. So that has also been a difficult scenario. And then the next slide. Okay, so this is a great website as well. This is the Trevor Project. So you can access them at trevorproject.org. Tons of information, facts, different ways that we can support our youth, different resources that they're able to utilize. They have hotlines, text lines. Text lines are pretty important across, you know, across the spectrum, from domestic violence to suicide prevention hotlines to ones for substance abuse. Just because the nature of getting on a phone and with others being around is that you can be heard. And a huge thing that folks with mental health, substance abuse issues that they deal with is stigma and not wanting to be heard or keeping it private. And so text lines have actually seen like an increase in usage because it's a lot more private. You don't have to say things out loud. You could be in the middle of a grocery store and contact them. So that is something that has been utilized a lot more, which is really neat.
Okay, so here's some recommendations. Now, again, at the end of this presentation, there'll be some resources that are linked there for you. These next set of recommendations are coming straight from the NAMI COVID-19 Resource and Information Guide. Now, this guide is like, I think 27 pages long or something like that. And it is full of great information. Some of these text lines that Sabrina has mentioned, some online resources. But here's what NAMI, so NAMI is the National Alliance on Mental Illness. Here's what they've recommended to help people get through a pandemic like COVID-19. So certainly managing how you consume information. Everyone's tolerance for stressful information is different. And so it's really important for us to monitor our own stress levels. And if we know that certain news outlets or a certain amount of news is too much for our mental health to tolerate, for us to be able to somehow monitor ourselves and turn those things off so that we don't get overly stressed and anxious. Follow healthy daily routines as much as possible. Routine is great for our brains. Routine just lets us know, okay, this is what to expect. So find ways to build in routine, identify what might be missing from routine and adjust to meet that need. I just did a presentation last week for an organization in Las Vegas, and their biggest thing was we're all working from home, and where we used to decompress from the office to home, we no longer have that. And you know, where we were going to work to do those tasks, now we're doing those from home and we're getting more interruptions. And so finding ways to, you know, to decompress between work day and home life, you know, finding ways that work for you to come up with those replacements as far as behaviors goes to help set those routines. Taking care of your physical body. This is super important. I'm a firm believer that our physical body and our mental health are directly connected. You know, if we're not feeling well, it's a lot harder for us to manage our emotions. If our need for exercise and movement is impacted, then we're going to feel less well. Sleep, like I said before, especially with adolescents, their sleep schedules are completely off. I literally sent an email to the parents and said, please monitor your child's sleep. You know, while they're 16 and 17, and we would think that they would be able to manage that because they've been thrown into it so quickly. So much has changed. They're stumbling with making sure that they're taking care of that need, as well as eating whenever they need to as well. The next slide, please. Practicing relaxing in the moment. There's on the NAMI resource guide, there are some really great links here for mindfulness. Mindfulness is awareness. It's how we're feeling. It's our emotions. Meditation, it creates a space for us to decompress, and it creates margin within our life, our schedule, our emotions. And so those things are both very important with managing the stress. Do meaningful things with free time. I know a lot of people enjoy reading. You know, find a new author that you love, or learn a new skill. I have patients who are working on their artwork, and one of my patients loves, like, she wants to be a tattoo artist, and so she's learning new skills for that, and you know, researching and things like that. So doing things that are meaningful for, you know, each individual. Let's go to the next slide, please. Staying socially connected. You know, this has changed for everybody, of course, but there are still, thankfully, because of technology, there are still options for us. So somehow, whether it's, you know, family meetings on Zoom, or family meetings on FaceTime, or something like that, or, you know, time with your friends in that way. You know, making a cup of coffee, and instead of going to, you know, a coffee house, you can call up your friend and do it on video chat or something. There's lots of creative ways to stay socially connected. Just kind of thinking outside of our old routine was great because it gave us some stability and structure. Now it's all changed, so we kind of have to pivot and figure out, okay, what can I do in place of what I used to be doing? Finding a mental health community, meaning those extra supports, whether it's online. In the NAMI resource guide, there are lots of warm line directories. So, you know, there maybe someone is not suicidal, but they need to talk to somebody. And so there are some warm line options there. There's the NAMI helpline, a crisis text line, which is really great. That's a live person. I have heard sometimes the suicide hotline has quite a wait. I imagine the wait has only been extended if for a physical phone call, but this crisis text line, there's someone live there almost immediately. And so I've heard great things about that. So there's lots of other mental health community options that we're not going to go completely into and list them all for you, but in that resource guide that we have included, they're on page 7 if that helps. Also connect to a spiritual or religious communities. A lot of, you know, spirituality helps create a space for peace. And especially now during a pandemic, I think a lot of us have lost our peace because of the extra anxiety and stress that we're experiencing. And so a spiritual or religious community can help people find that. There are a lot of places of worship are going online, even being virtual in that degree. So it's even more available from a technology standpoint. And then other online support communities as well. Again, this is all from the NAMI resource guide, and they're listed in the guide. And so that would be on page 8 once you get an opportunity to look at it. Just lots of online opportunities there too.
All right, and then we wanted to end the presentation on the note of self-compassion. Obviously, we've been through 2 to 3 months of all of this. It seems like we're kind of letting loose on some restrictions, so the normal that we got used to is now going to start changing again. And so something that we want to kind of shout out is just to have some self-compassion towards ourselves, like, hey, we made it, we're surviving this. But we also want to address that it's self-compassion and compassion towards others as well, because just as much as we're going through something, others, we're all kind of in the same boat, but you know, we're handling it differently, or we have different stressors, different things that are going on. So these little squares that are up on the little thing that's on the screen, they are from a social media outlet on Instagram. It's called The Mind Geek. They actually operate out of Dublin, Ireland, which is pretty neat. And, you know, youth are very responsive to social media and like things that are colorful and condensed. And so what The Mind Geek really goes over is mental health tips, conceptualizing certain things that might be a little bit hard to understand, trying to make it simplified. And it also has reframing skills, which is really nice, because the idea behind that is you change thoughts, you change beliefs, which therefore changes actions, changes situations. It's like planting a seed. Another thing to address is like our ingestion of things on social media or, news outlets. Like if somebody is watching the news constantly, you're going to be in like a constant state of arousal, like trying to find out the newest information and trying to figure out what to be panicked about next. So we need to be mindful of maybe the time that we're spending on social media or online or watching the news, everything in moderation. So there's a few ones over the next few slides, like this one on the left, small ways to support relationships while in isolation. The benefits of slowing down. A lot of talk has been around being productive during quarantine, making sure you're doing something, accomplishing something, do this next house project, learn this new skill. And sometimes we just need to be okay with slowing down and maybe doing nothing for a period of time. On the next slide, there is another one about coping, so reframing skills. Anxious scrolling, so if we're trying to find information over social media, or we have just tons of downtime, and maybe the first thing that we do is pick up our phone and try to engage our brain in some way, shape, or form. So being mindful of how much time we're spending on that, and maybe like the intent or what we're trying to get out of it. And then one more slide with cute graphics again, gentle reminders and different ways of coping. So if you have teenagers, work with teenagers, this specific platform I found very helpful because it's very simple and it's aesthetically pleasing, at least for me. So it's something that I've shared with kids on inpatient. You can also make referrals to teenagers, people that you're working with, even adults. Obviously, I'm an adult and I use this. So it's just nice little simple reminders throughout your day. So maybe take a deep breath, to not feel as overwhelmed, to kind of be in a little bit more control. And then next slide.
Just some additional examples of the kinds of things that the MindGeek offers. Next slide. So just some final recommendations. It's really important to know when you're working with teens who have some extra mental health stress going on because of the pandemic. How do you know when to make that referral for outside professional help? Some of the red flags that we look at are changes in behavior. Of course, because of the pandemic, we're seeing lots of changes in behavior. Safety issues, inability to care for themselves or others, threat of harm, those kinds of things. Definitely, those are all opportunities to make that referral for an assessment. So here in the state of Nevada, all mental health treatment begins with an intake assessment and referral to the most appropriate level of care. And so one thing that Spring Mountain Treatment Center does at our 7000 West Spring Mountain Road in Las Vegas location is that we have 24/7 walk-in assessments available. And we can also, I could also recommend that if you're with a patient and you want them to schedule an assessment, you certainly can call our intake line, which is 702-312-1919, and make an appointment. That way, before a patient even leaves your office, they have an appointment to show up and get an assessment referral and referral. The services that we provide here at Spring Mountain, we provide acute hospitalizations. Those length of stays are generally around 7 days, sometimes shorter depending on each situation. We also provide the intensive outpatient level of care. Intensive outpatient is group therapy. It meets 3 times a week for 3 hours each time. And we do have adult versions. We have a morning group, an afternoon group, and then the adolescent group that I run is in the afternoon after school would be. So from 3 to 6, 3 times a week. So those are the services that we offer here at Spring Mountain Treatment Center. In addition to potentially some of, oh, I'm sorry, the phone number I was just corrected is 322, not 312. So 322-1919. Thank you, Tony, for correcting that for me. Let's see here. So as far as formal presentation goes, there are the resources that I was speaking of earlier, the NAMI resource for that document, as well as there's a couple of other great ones you can print out. These are not copyrighted. Hold on, can we go back one slide? I'm sorry. So you'll see the coronavirus anxiety workbook. That is for individuals. It is not copyrighted. You can print that out and have it in your office and hand it to someone to work on at home, or you can work on it with them in your office. So this is a great tool just to build resilience during the COVID outbreak. Also, you'll see a family workbook. So if you're working with families, this is a great workbook just to help families kind of get through this together and stay on the same page and work together. You'll also see the Child Mind Institute website there linked, as well as recovery support. So the recovery supports are specifically for people in the substance abuse community who are trying to maintain recovery. And there's like peer warm lines and stuff like that. So those are great resources for you to access after we're done here today. All right, so now I think we're ready for we have a couple of minutes left for
The Q&A.
Yeah, Q&A. Do we have suggestions for helping teens use technology responsibly during this time? My suggestions are, of course, parent guided. You know, I think parents do need to be aware of where their children are going online. And especially the amount of time. So definitely creating some time limitations for that. I know my own phone tells me how many hours I average on my phone every week, or excuse me, how many hours a day, and mine's gone up too, right? Because we're not able to get out and do as much activity as what we normally would. And so just making sure that, you know, parents are helping kids make healthy decisions. I'm a firm believer that 16 and 17-year-olds, like they're staring down adulthood. And sometimes parents still need to give them guidance though, to help them, you know, make healthy choices for themselves. And then the next question, what is a bit of advice we can give adolescents in our life if they're struggling to reach out to the resources you've listed? How can we encourage them to help? I think empathizing, right? Like this is hard for all of us. And, you know, certainly being able to let them know that, you know, it's okay to ask for help whenever they need it. I think kids, well, people in general, but at least the kids that I work with, they feel like if I ask for help, that means I'm somehow weak. And to help to ask for help. That's the same. Oh, here's another one. Do you want to do this one?
Let's see. Do you have some advice on how to or when to start preparing to enter back into normal life? Loaded question. So a big thing that I kind of learned early on is my consumption of news. And when I was working with adults, talking about consumption of news, because the thing that we're all trying to work towards is stability. We want to know. We start doing things out of fear and out of the unknown. So as far as advice on how to start prepping back into normal life, I don't really know. For me, as far as like news outlets and things like that, I've let my news outlet be the CDC. And so unless they're saying something or they're saying that it's appropriate, okay, then, you know, you kind of start moving on that. Because everything else, I mean, these different news outlets, you have like a piece of information and then you have 5 people on a panel give their impressions or their thoughts and feelings about it. So I wouldn't really know how to answer that question on how to start prepping back to normal life, whatever normal life ends up looking like.
And certainly, I think taking it in stages too. Mm-hmm. If parents notice their child is acting strange, how can parents open up that conversation without seeming scary, right? I notice, especially with the teens that I work with, like they'll talk to me about emotional stuff easy because I'm a neutral party, but identify what you're observing. I notice you're feeling, or I notice you seem more stressed, or you seem a little bit fearful. Is that right? Can you tell me about it? And let them say, yes, I'm totally terrified. Or no, one of the biggest things I hear from teenagers is when teenagers say, you know, I'm stressed or I'm anxious or I'm depressed, and parents will respond with, well, you shouldn't feel that way. That is my biggest no-no for parenting. Listen to your child. They're telling you how they feel. And you may not understand it. You may not even think they should feel that way, but they are feeling that way. And so giving parents, or excuse me, giving children and adolescents the floor to say how they're feeling and not you know, condemn them or minimize how they're feeling. So observing what you see, saying that out loud, and then asking them if that's correct, and then letting them explain further.
And it doesn't have to be an all of a sudden awkward conversation. You could do it over a bonding activity. Maybe,
a car ride.
Game night,
Yeah.
doing a puzzle together. You can do it both at the same time, and it would make it less awkward. It's like a functional capacity where you're doing something, so not all the attention is on that conversation, which I think teenagers find awkward, is when all the attention is on them. They tend to, you know, shut down. And so if you have maybe a distracting activity, you guys are making a meal together, that could be an excellent time to have that conversation.
You could even share a journal. So like, you know, a parent might write down a question to their child and like slide it under their pillow at night, and then their child finds it and they see, oh, my parent is asking me about how I'm feeling. So then their child writes back and they, you know, slide it under their parent's pillow. Like I've heard of parents doing that because there's something about writing it down that helps, and it feels less scary to be able to express themselves in writing rather than face to face. And it looks like Immunize Nevada would like to speak.
Oh, I'm sorry, guys. I wanted to give you guys an opportunity to answer that last question. And then before we say goodbye, just offer a couple more minutes. I know we're a little bit over time for last minute questions. So if attendees, you'd like to type those questions in the chat box now, you're absolutely able to. And while we're waiting for those questions to be typed in, just a couple of reminders. If you've requested continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended. All CE certificates will be emailed out within the next week. And then if you'd like to view or share this webinar, the recording will be available on the Immunize Nevada website, along with information for future webinars. Please visit immunizenevada.org/webinars for those details. It doesn't look like any additional questions have popped up. If you happen to think of any questions after the presentation, you can feel free to ask those either in the survey or by emailing info@immunizenevada.org, and we will pass that along to the presenters. And with that, we'll go ahead and conclude today's NILE webinar. Thank you again, Tiara and Sabrina, for bringing your expertise to our coalition. And thank you to those of you who participated today. Have a great day.
Thank you.
Thank you.